Hi everyone, my name's Emily. I'm one of the pharmacists here at MD Custom RX. If you haven't already, make sure you go check out my YouTube video from last time about yeast infections. Today we're going to be talking about bacterial vaginosis. This is when there's an imbalance of good and bad bacteria in the vagina. It can also lead to a disruption of vaginal pH. We're going to talk all about this and things that we can do to repair the vaginal microbiome. Let's get into today's content. The vagina is home to multiple different kinds of bacteria. Similar to the gut, it's known as a microbiome. Bacterial vaginosis can occur whenever there's an imbalance of these good and bad bacteria, and it can also be caused by anything that can cause a disruption in vaginal pH. Some examples of this include douching, not using condoms, having new or multiple sex partners, and even hormone imbalance. It's not a sexually transmitted disease, however, it can be linked with sexual activity. Symptoms of BV can include a gray vaginal discharge, a strong fish-like odor, which is most common, and that's especially after sexual activity. Can also lead to pain or itching inside the vagina, can even have burning during urination. It's frequently occurring in postmenopausal women due to hormone irregularities in that estrogen and progesterone as that drops over time. Women who suffer from recurrent BV are usually stuck in a constant cycle of symptom improvement and then regression, and then sometimes they might get prescribed a course of antibiotics, which can unfortunately disrupt the vaginal flora even more, and that can kill off that good bacteria. When we're struggling with BV, it's important to practice good hygiene. Don't wear clothing that's too tight or holds moisture. Make sure that you avoid scented soaps or perfumes down there. In order to fix the problem, it's really important to get to that root cause, which is actually fixing the pH and bacteria balance of the vagina. This can be achieved in a few ways. First thing that you need is to be on a good probiotic. You want to make sure that the good bacteria will have a chance to balance out those bad bacteria. And in order to do this, you need supplementation. It's important to take a lactobacillus-based probiotic, since they are playing a major role in maintaining vaginal health. We actually carry a great women's probiotic here for that exact purpose. Another consideration would be to test your hormones, which we do also have test kits here at the pharmacy for. Vaginal irritation can occur with drops in estrogen, which then increases the risk for infection. Women who've experienced drops in estrogen due to menopause, pregnancy, surgical removal of ovaries, or even certain types of birth control can really benefit from hormone restoration. Something that we compound at the pharmacy is called boric acid. As a suppository, this can be really useful in treating bacterial vaginosis. The exact mechanism of boric acid is not really known, however, it has been shown to have antifungal, antiviral, antibacterial, and even antiseptic properties. It can help restore that vaginal pH. If you think of any further questions, please feel free to comment on the video below. Thank you for watching, and I really hope that you found some value in today's video. As a reminder, we do offer one-on-one consultations here at the pharmacy where we can go over your medication and supplement history and even offer recommendations to further optimize your health. If you're interested in that, please call us today. I would also encourage you to watch my full-length vaginal health seminar on our YouTube channel under the live section. In the next video, we will be talking about different topics surrounding sexual dysfunction. I hope you have a great day, and I'll see you next time.